Today, this lesson is going to be in two parts, so you're not going to have a quiz after this today. We're going to talk about coronary artery disease, which is short formed as CAD. So as long as you know what CAD is, well, you can call it that. Alrighty, so remember again, this is coronary artery disease is the major form of heart disease in Canadians. All right, so about 1.6 million Canadians have coronary artery disease, and if you remember from yesterday, we talked about heart disease and stroke being the second leading cause of death in Canada. And in coronary artery disease, what's happening is the coronary arteries of the heart are affected. So hence the name coronary artery disease. And basically what coronary artery disease is the arteries that feed the heart itself oxygen and glucose and removes all the waste. These coronary arteries are the ones that are affected. So they're narrowed or they're blocked by fatty deposits. So here's another picture of the coronary arteries. If you remember when we looked at the sheep hearts in grade 10, and I know grade 11 we did hearts as well, and you probably did in your other biology classes, you have the arteries. So this is the aorta. The arteries come back to the heart, some parts of them come back to the heart itself and feed the heart with nutrients and oxygen. And you have the branches that come off the coronary arteries as well. So there's one that goes through the back there. This one goes around the side here as well. All right, so the whole entire heart is getting a nice supply of blood. Here's a cadaver heart that's being cleared off of all the outer fatty layers, and so you can really see what the arteries look like feeding all across the heart. And then the next picture is kind of cool because what they've done is they have taken all the flesh of the heart. They've put like a resin through here, plasticky resin, to highlight all the arteries, and then they've dissolved all the flesh. So what you've left behind is the blood system of the coronary artery, so you can see how much the heart muscle is fed by the arteries. All right, so what happens when you have coronary artery disease? Well, there's a couple things. There's more than a couple, okay? Keeping in mind again, we're just doing this real quick. So you can end up with stable angina pectoralis. They'll just say stable angina. Basically, it's chest pain, and it's fairly predictable. So if you're out, you're exercising, you get some chest pain, you kind of expect to have that because it's predictable. Or you're really stressed, you're running around, all right, you're really upset, you'll feel that chest pain. So that's stable angina. You can also end up with acute coronary syndrome. So what happens here is you can end up with having unstable angina, which is unpredictable. So basically you don't know when it's going to hit, doesn't make any sense. You can be sitting there calm as a cucumber, or cool as a cucumber, calm, no stress at all, and all of a sudden you end up with heart pain. You can also end up having a heart attack. Now the proper name for a heart attack is myocardial infarction, or short form as an MI. Basically what a heart attack is, it's when there's no oxygen that reaches heart tissue. So you're going to end up with heart tissue that is completely damaged or dead because it's not got oxygen with it. It needs to be treated within about 20 minutes, or you'll really start to have damage to the tissue, or death to the tissue, or death to yourself. And what I want you to look up what a widowmaker is, because it's a specific artery that's blocked that will cause pretty well death, which is why it's called a widowmaker. So here's just a little diagram showing you this guy, and a little bit of heart damage, well, like an area right here where there's no oxygen getting to the heart. So this muscle around here has been damaged. Alrighty, why am I not going? Oh, there we go. Okay, so the cause. So why do people end up having coronary artery disease? Well, basically what you're having is you're having this stuff that's called plaque. Now, plaque is cholesterol, there's some calcium in there, there's cell waste, so it just gets really hard, and we call anything that's kind of hard like that a plaque. It hardens in the arteries, and that's called atherosclerosis. So sclero means like rock-like, hard-like. So this is a hardening in the arteries. So we've got our arteries that are being narrowed and clogged and reduces the blood flow. And there's a little bit of a danger here because sometimes what happens is if this little layer of lipid calcium cell waste, it's jiggity jaggedy there, right? So you can see that. Sometimes little pieces will break off as well, and then what'll happen is the platelets will come along here, and it'll start to form up a blood clot, or your little red blood cells, as they're rushing by here, get caught on this little jaggedy ends here, and you end up forming a clot. And then it's the clot that will cause the blockage in the arteries. So what is plaque? It's a sticky yellow substance that is made up of cholesterol, calcium, and cell waste. So here's a picture of a big artery with a big clump of plaque being taken out of it. Oh, there's a couple videos that you don't really need to watch. So what are the complications with having this clumpy plaque thing? Well, one thing is that the plaque ruptures and it embolizes, which means a little piece of that plaque breaks off and travels through your body. And guess where sometimes it ends up? Up here in the brain, all right, blocking off blood to certain areas of the brain, and that would be a stroke. So we have a clot that forms. So we can end up having, like I said, a heart attack where we've got the clot that's formed right in that blood vessel, or we can end up with a stroke. Now the symptoms. So the symptoms of coronary artery disease, they usually don't show up until after you're 50 years old. So you can have problems, and then once again, 50 seems to be the magic number of when your whole entire body starts to fall apart. So you can have things like fatigue. Now what's really funny is you can have people who really take really great care of themselves. They run, they do all sorts of stuff. And if they have a genetic predisposition to having coronary artery disease, unfortunately for them, sometimes they end up with it, no matter how healthy they are. I had a friend who was training for marathons, or actually was running marathons, and ended up being rushed to the hospital and having to have heart surgery because he had such blocked arteries. So pain, again, if you have pain, shortness of breath, and for men, a lot of times they have a squeezing, suffocating feeling, and pain in the center of the chest. So this kind of like what you see on TV with people where they grab their chest or they grab their left arm. All right, you can also even have pain up into your neck and into your jaw as well. And a lot of people have a feeling like they're having really bad indigestion, like a burning feeling in the back of their throat as well. So men tend to quite often get pretty severe feelings of having a heart attack. Women just have this chest discomfort feeling. They just don't feel well. They feel like maybe I ate too much, maybe I needed an antacid, maybe I just kind of did a little bit too much exercise or whatever it is. They just have this, not all the time, but they can have this vague sense of discomfort. So how do we diagnose? Well, first off, you're going to go in and have a physical examination, and your doctor's going to ask you about your past health and ask any of those risk factors that 90% of the population have at least one of. Probably do a chest x-ray, so get a nice picture of the heart there. Do an ECG. We haven't talked about ECGs yet, but this is where we get the electrical printout of what your heart is doing, like an electrical thing. We'll do some blood tests because there's certain enzymes that will show up in your blood, or certain chemicals that will show up in your blood that'll give you an indication of whether the heart has been damaged or not. You can also go for a stress test. So you'll go on to a treadmill, you walk on the treadmill for a while, they've got the ECG on you, and they take a look at before and after and what your heart's been doing. All right, so we talked a little bit about those heart factors. So this is a little sideways kind of thing when we're talking about diagnosis. If you have type 2 diabetes, higher risk of heart disease. If you have hypertension, so high blood pressure, remember Canada's quite good at controlling high blood pressure, but it's up to the individual person to make sure they control their high blood pressure. Abnormal blood lipid levels. So if you're going in and getting blood testing and they tell you your lipid levels are high, change your diet to try to change that. Sometimes there's medication as well. Tobacco, bad no matter what. Physical activity, if you get no physical activity, you probably have a greater chance of having heart disease. So increasing your physical activity and being obese. All right, and you know, in our minds, I always think of obese as being really, really, really overweight, but it can be as much as 30 pounds overweight. You can be considered as being obese. So it's staying within the healthy weight range for your height or your size. All right, so what else can they do for diagnosis? Well, we can do this thing that's called an angiogram. So an angiogram is an x-ray of the coronary arteries with a dye. So they inject the dye and they can look through, they can put you under or do an x-ray on you. This is a moving x-ray, so it's a x-ray that's kind of always on and they can get a good picture of the coronary arteries. So here in this angiogram, you can see right here where we have narrowing of the arteries. So they would know right there that's a problem in there. So basically what they do is they put a catheter through a blood vessel in your groin or in your arm, so it'll feed up through the blood vessel through the groin or in through your arm. And what they do is they feed it up towards the heart, and then they release a dye when the catheter is near the heart. So it's just this big long tube, and then they inject a liquid dye, so when it's close to the heart. So we can now have a peek. And if you notice here too, I'm going to show you in the next sentence that comes up here, but see how you can see this is, I'm not saying this is a perfectly straight artery all the way along here, but see how there's this bulge right here, right before the little constriction here, we've got this bulge. So this is where blood is pooling. It's almost like this little beaver dam, and then you got a little pool behind it. All right, you can tell I've been spending a lot of time in the bush hiking. So this can show you where there's atherosclerosis, where blood is pooling, and where also you're getting some backlog of blood. The cost for this is about $120. So a fairly cheap, easy way to look at your heart. It's pretty common, it's pretty safe. All right. Sometimes people have a little bit of a reaction to the dye. And again, remember I said with those kind of dyes, a lot of times they give you this feeling that you really, really need to pee. Some people also have a feeling that it kind of nauseates them. And the other thing they have to be very, very careful of is making sure that they don't loosen that plaque. So that's one of the side effects as well, is that they could loosen a plaque and then you end up having a blockage somewhere down the artery. So that's that for today. There's no quiz with this today. I was kind of feeling like if I double this, it's just a little bit too long. So you've got plenty of time to finish those other quizzes. Make sure you're working on your ISU, and we will continue this note tomorrow.